Welcome, welcome. My name is Aoife, and I am a mind body coach. I mostly work with sensitive women and I teach them tools to heal themselves from chronic pain, chronic illness, anxiety, and depression because this is something I overcame. I had 30 years of debilitating, awful diagnosis I was told were incurable. I had to live with forever. Anyway, met Dr. Schubiner through a 5-minute online video, and everything began to change for me. So this is what I share and help women with now. And I'm super grateful to have Dr. Yonit Arthur with us today to share her wisdom and expertise and experience. She is a board certified audiologist, vestibular specialist, and coach who specializes in helping people with chronic dizziness and other vestibular symptoms, as well as tinnitus and hyperacusis. So, welcome. Thank you so much for being here.
Thank you for having me. I was just saying offline that I'm just so grateful for the opportunity to speak to more people about this because those particular symptoms don't always get the airtime that chronic pain does, right? So it's like, oh, yes, let me talk about dizziness to more people.
I love that. And it really helps, even though the process is probably the same for like most symptoms, but
Totally.
it really, really helps. I guess like people to feel held and understood, and it gives them the reassurance when you can hone in on one specific thing. And I I have never had tinnitus as a problem. Sometimes my ears ring, but it's never bothered me, and it's just like comes and goes. And actually, years ago, a friend of mine's mom said it was like angels sending you messages. So I was just like,
All
okay,
about the framing. There you go. Keep going. Yes.
I was like, woo, messages coming in. So, but I have been around a lot of people who, throughout my life, I used to go clubbing a lot and have a lot of friends who are music producers and DJs. And there was always a lot of talk about tinnitus, and we were getting special things for our ears and around the speakers. And um, so I do know a bit about it. And of course, I have clients who have dizziness and they have these symptoms. So, yeah, I'm excited to dive into this. And I interviewed on the channel. I can't remember his name, but he wrote a book on healing himself from tinnitus in particular.
Wonderful.
So yeah, good
Good.
to
So you've set the precedent already that this is something people can recover from.
exactly.
Wonderful.
So yeah, what I suppose is this a symptom that you suffered with personally, or what drew you in? I suppose you had a background in audiology.
Yes, yes. So for me, the interest initially was just academic interest, I suppose, or really backing up to when I decided to become an audiologist. This was just one of my areas of interest, specifically tinnitus, because that's something that a lot of audiologists learn about in graduate school. Interestingly enough, less dizziness, but we can get there. And what really is interesting about tinnitus is the conventional world knows it's a mind body symptom. Like we've known that for a really long time. The gold standard treatment for tinnitus, among other things, is cognitive behavioral therapy. So we know that the mind is playing some role in tinnitus being an issue. But just like CBT for chronic pain, there are some limitations to what CBT can do because it really, again, I'm not speaking against CBT as a tool. It's an amazing tool. But when you're starting a treatment with the words, and I'm not exactly quoting, but they will often start trainings like this. Your job is to help the patient manage his or her chronic symptoms. Then we're kind of setting the stage for the ceiling that the patient might have in terms of how he or she can recover, and that's a low bar in my opinion. But back then I didn't really question that. I started my career in audiology working conventionally, and just over the years became frustrated, not just because of tinnitus but also because of the people I was seeing with dizziness. And audiologists already do tremendous work, especially in tinnitus, and do a lot of good and help a lot of people. But again, I felt like you hit that ceiling. Like there's only so much you can do when the only tools you're using are things that are held down by the word management. So at this point, obviously, I've moved far away from that. I'm fully on board with, I will use the words recovery freely, but that's not how I started in my career.
I love that. Yeah, I obviously having lived for so long with fibromyalgia and chronic pain and IBS and all these different things, it was all about management. And I love to use the words break free. Like I can help you
Mhm.
break free because it also takes the pressure off from like this destination where you have to get to where you're you're completely have no symptoms or you have
Right.
none of those things in your life. But breaking free is more open like to when it comes to the symptoms.
Yes. And I love that term. I just feel like for a while I was uncomfortable with the word recovery, just exactly for the reason that you stated. Am I really trying to tell people all of you will never have sensations ever again? But then I was like, when we're talking about chronic symptoms, I can get people out of chronic symptoms. And that's what I'm saying. Recovery from chronic symptoms is totally possible. Yeah, you may have a sensation here and there because goodness knows every single person has weird sensations sometimes. And it may be annoying. You may have something akin to having a really bad headache or, a half a day where you feel kind of nauseated or motion sick or what have you. But that's recovery from chronic symptoms. That's not a chronic symptom if it's something that's transient and that's mild and that doesn't disrupt your functioning in the long term.
I love that as well because I love the word recovery because as you keep saying it, I'm just reminded of everything I recovered. Like I was on disability, I was bedridden, I couldn't have relationships basically of any kind except for some like online friends that I were also sick that I would cry with. Um, I had no joy. I had no light in my eyes. I had no hope. Like, so all the things I recovered, like recovery is not just
Yes.
like, this one narrow thing. It's like, what else can you recover in your life? I've recovered my relationships. For me, that's one of the richest things that I recovered from my healing journey. And my friendships and my family relationships for me are really a massively important part of my life. And I recovered them in a rich way that I never thought possible. And I recovered my joy. Like, even though I might cry, like, and have my downs and my dips and the natural cycles as you continue to heal and grow. But I really recovered a new kind of level of joy and tenderness.
That is such a great point. Here we are focusing on symptoms when probably, like me, you're always coaching people. Okay, stop focusing on your symptoms for a little while. Let's focus on other stuff. But that's actually really, really appropriate to say, and also just something I've seen also in on the people I've seen recover and get better. It's more than just, oh, I recovered from symptoms and I just went back to the way things were. They live better lives. They live richer lives. They, I mean, it's not just the recovering function that they lost. They recover greater than what they lost initially. So thank you for pointing that out.
Yeah, definitely. I always say, like, if you met me in 2017 when I was stuck in bed and you asked me if I, like, you were a fairy or a genie in a bottle and I had one wish, I would just wish for my symptoms to be gone. But what I got was so much better. Um, and that's
Yeah,
really what recovery is about.
yeah, absolutely.
So tell me a little bit more then about the specifics, maybe of dizziness. I forget, did you say something that you suffered with yourself, or is it?
So also note, although of course anyone who ends up in this field has had some kind of
Oh, God.
symptom. So I can give you my list of symptoms.
Yeah.
So in graduate school, interestingly enough, I went through what probably nowadays would have sent me on an absolute medical spiral if I didn't know what I know now. But back then I was poor graduate student. I couldn't afford to go to doctors, which again may have actually been helpful. But I had all these like autoimmune type symptoms. I had rashes, my hair was falling out. I was just, I had all sorts of terrible digestive issues, IBS type symptoms. And I've had migraines for a very long time. So that was going on too. And this was all coinciding magically with the fact that I was in graduate school under a tremendous amount of stress and was already kind of disillusioned with the career path I had chosen. I just want to clear this up for any audiologists who are listening. I have a like deep, passionate love of audiology. I love audiology. Uh, what I discovered in graduate school was that I wasn't actually going to be practicing audiology. I was going to be essentially a diagnostician. And I wasn't actually going to be using the wide range of skills and knowledge that I acquired as an audiologist to help people in the way that I wanted to help them. I was going to be practicing in a very narrow, like a very narrow range of skills and in a very narrow scope of practice, which is unfortunately just kind of how conventional audiology right now works. So this is no criticism of audiology as a field at all. It just the general practice of audiology, unfortunately, is just relatively narrow. So I was going through a little bit of an existential crisis about that, and I had all these symptoms. So surprise, but I got out of that because in my second year or third year of graduate school, I did a big research project on doctoring professions, and I kind of found the light, like, oh, okay, but maybe as an independent doctoring profession, we can kind of pave our own way and expand into the realms that we're actually experts in. So my symptoms, again, magically subsided. And then for the first 7 years or so of my career, I was very preoccupied with just being a new audiologist. There was a lot of new stuff to learn, and it was really exciting. I love people, so I love getting to know my patients. And I was in the process of starting a family, so there was just kind of a lot going on. And when things settled down, and Aoife, I'm sure you hear this from people too, I get asked a lot, like, Yonit, you say this is stress related, but it was when my life was actually going really well that my symptoms started. Yeah. So finally things settled down. I wasn't distracted anymore. And then I had just kind of a crisis about my career again. And alongside that, I had I had a recurrence of a whole bunch of those symptoms from graduate school. And I also developed chronic back pain. So that was all going on. And between the back pain and then just also feeling a ton of anxiety and just feeling like super unhappy with the way my career was working out. And again, I just want to be clear, no, I know a lot of audiologists love the day-to-day jobs they were doing. It just didn't feel fulfilling to me. It felt like there was so much more I could do for people and I just wasn't able to do them. And I was like diagnosing people, putting them on a conveyor belt and like sending them off into the ether to be prescribed pills when these people, you've seen people with dizziness, they are suffering so much. They are suffering so much and they look normal on the outside. And then the sensations they're describing, like if you don't know any better, they sound insane. They sound like psychiatric patients and they're not. This is an actual, they're actually physically experiencing symptoms. But when you're faced with that kind of despair and these kinds of symptoms, and you can't do a thing to help them, it's just like I've started to use the term, it's almost like like a little injury every time. It's like I have all these skills and all this knowledge, and I can't actually apply it to actually do anything. I feel powerless in this situation. And I think over time that affected me. So I quit audiology, said I was going to become a personal trainer, and then I could at least, people would come for me for exercise and I would give them exercise. And so it would be very clear what my role was and what their role was. And then my mom developed chronic dizziness, and she started asking me questions about chronic dizziness. And I was like, oh, I guess I'll reopen my textbooks. You know, by that point, I think I'd been a year out of my career. So I was like, oh, well, I'll just look in my textbooks. And I had been on kind of my own learning process, like what was going on with me. I was starting to develop a lot of insight about the things I was just telling you about. And things just kind of started clicking for me. Like, oh, well, if I'm brave enough to go out on my own and be a personal trainer, who says that I can't be brave enough to actually help people who are dizzy, but just not do it in the medical system? And I was just so I developed, I found, I rediscovered my passion and my curiosity about everything that brought me to audiology in the first place. So I went back and did a bunch of trainings in vestibular rehab, and then people started finding me. It was weird. I was working, I had no intention of becoming a coach at all, or having a YouTube channel or any of that. This was totally unplanned. I just found that people were finding me somehow. I was working as a contractor, working part-time. I was perfectly happy. And people with PPPD, which is a type of chronic dizziness, and we can go into a lot of detail as much as you want about that, but they started finding me, and it, I just kind of rolled with it. And they needed a lot of repetition. So after a while, after maybe a year, maybe longer, no, it may be longer than a year, but after a while, I started making YouTube videos for them, thinking, okay, well, you can just watch them. If you want to hear me repeat this a second time or a 15th time, you can just watch the video. And then other people started watching the videos. And it's, by the way, extreme, like, it's very apparent that I had no plan for anyone to ever see these videos if you watch my initial videos, because they're so bad. I mean, like, the camera's crooked, and I'm like in like weird lighting, and people complain about it. Sometimes they comment. I'm like, I'm sorry, no one was ever supposed to see these. These were for like my own personal patients. But that just, after a while, it just became so clear over and over, the stories, the comments, the emails. These people were not being helped. There was no help. And I was one of those people who wasn't helping them. And like that, I feel like part of what I'm doing right now maybe is not atoning like in a guilty way, but like I'm making up for all that time that I wasn't really effective. I wasn't effective, and now I can be effective. So it's like driving me to put out as much information as I can. So that's how I got here.
It's really beautiful and really heartwarming for me to hear. I was speaking with Dr. Becca just recently as well, and she was also sharing this similar struggle that you're sharing as a doctor. And so like my dad is a doctor. I come from a family of doctors, and I was always brought to the best doctors in London when I lived in London as a child, and in Ireland, the best pediatricians and the best like them. But I remember being a teenager. I had all these sicknesses as a child. I had recurring fevers. It was called like I can't even remember what it's called, some syndrome of recurring fevers. And it was like, well, there's nothing wrong. There's nothing wrong with, but there was clearly something wrong. And anyway, it got to being a teenager, and I had acne. I had this severe period pain. And I remember I was so angry and so devastated. And I was like screaming at my dad. You know, I used to have such like fights with him. And I was like, I don't understand how you're supposed to know. Like you're like, I was really like pointing the finger. I felt hurt, and it wasn't like his fault, and it wasn't like any of those doctors' real fault. It was just like I felt the devastation of this black. I was like, there's something missing. Like
Yeah.
you're presenting like well, I have been presented that this is people or the place you go to for answers, and I have not yet found an answer. So I find it interesting. I think it's probably helpful for people who have felt that as well to hear from the doctor's side that, you know, a lot of doctors get into this profession. They want to help people, and then they must
Absolutely.
feel that disconnect as well. And I did have a really beautiful, amazing doctor coming close to when I found the mind-body connection. And she didn't know anything about it, but she did this thing with me that no other doctor had done, where she listened and she let me come up with all my own theories. And I was coming up with all kinds of things. I was determined to figure out what was going on. And I was like, okay, now I think it's this, and then maybe it's a B6 deficiency. And she's like, okay, run with it and let me know. And she gave me this permission field to explore. and she stayed with me. So that was amazing. And then I came in one day with the Unlearn Your Pain book, and I'm like, look, and she said, Aoife, I always knew this, and I didn't have the words to say it. And she asked me then, a while later, she said, like, how did you come to that moment where you were open to this information, and how can I share it with my patients? So yeah, I mean, it was her warmth and her openness that was ultimately helpful for me, and not her having all the answers and her knowing.
Yeah.
Um, but yeah, I suppose I find that the information I can receive it most easiest from doctors or people who have gone through it themselves, or have because it kind of it softens. They're a little bit softer. They're not so much like telling you you're stressed, you have this like emotional issues, and that's what's causing your problem. They're saying like, I see you, I hear you, I get you. Let's figure this out together. So I find that is a way of connecting to people.
Yeah. And really one of the things you said I think is so worth highlighting. Just people go into these professions to help people, all of them. Even you know, people who know they're going to be diagnostic physicians, for example. We're all going into this with a desire to help people. And I think that it's no single provider's fault that the systems work this way. But at the same time, I feel like I constantly not need to apologize, but I'm trying to help compensate for callous treatment that was totally unintentional, and not because someone was a bad person, but because they're in this system where you just, how are they supposed to help people in the way that we help people? It takes time, it takes like depth, it takes training, it takes conversation, and it's very difficult for doctors to do that. And even audiologists who tend to have longer with their patients, we're not the ones typically seeing people for like 5, 10 minutes. We usually have a little more time to sit with someone. But even in those environments, you get boxed in by what you've been taught in school, or like like what the practice guidelines are, what the insurance will pay for. And it limits us so much when Aoife, the tools that we use are not like far out woo woo, like weird. I mean, some of that stuff is, and cool. I'm all for it if you're into that. But a lot of it's just like, so what was going on in your life when the symptoms started? Did you know that stress can impact how your brain processes sensory information? Like these are just like very normal, like sciencey things to say. But even asking those questions is already outside the comfort zone of many providers.
Yeah. And it blows it. I was just in the gym a few weeks ago, and I was telling this woman what I did. And she said, oh, her friend had fibromyalgia. And I said, wow, that's one of the things I had. And I just looked at her and said, the craziest thing is it's actually really simple. It's actually really not so complicated. It's just not common kind of discourse, or it's just not
Right.
commonly understood. But for me, that is like one of the most mind-blowing things, that it is simple. But I guess it's also not so easy.
It's not easy.
That's the part. And it, even though it's simple, it's still layered. It's still like the symptoms, they have all these layers to them, right? These emotional layers and these narrative layers and these protective layers, like they're protecting us from different things. Yeah, I also don't want to diminish anyone's journey, because my journey has definitely been of healing. Like you go through all these years of symptoms, it's like hard and so difficult and terrible. And then you start healing, and for sure you start recovering, getting your life and joy and relationships back. But it's also a like a hard journey. You're doing some deep transformational work on yourself, and it can, the journey of being chronically ill is so isolating, and then you start healing can also feel isolating and hard in lots of ways. So
It
yeah,
does.
that's why, yeah, connecting with other coaches and doctors, and the community, that groups, like when you have group coaching programs, can be so supportive, because you can feel that connection. That's that's also massively part of the healing because the symptoms they cause so much disconnect. They disconnect you from your passions, your interests, your food, your joys. They disconnect you from your family, you feel, and then you're so disconnected from yourself. So the journey for healing, one of the simple concepts again of this healing journey is connection.
Absolutely. Absolutely. And part of that connection, I think, starts from like really being seen for what you're going through. And that's again, of course, I have a huge bias, right? I mean, I myself have suffered from chronic pain, but the people I work with overwhelmingly are dealing with completely invisible symptoms. I mean, with pain, again, not to diminish pain, I've been through pain, but with pain, you can point to it. And that makes it concrete for other people to understand, even if no one understands the experience of someone who's going through fibromyalgia. But there's some reference point. Whereas with dizziness or tinnitus, people do not have a reference point. And so I think the beginning of the journey for people who are recovering from those particular symptoms, and I recognize my bias here because I work with them, but it's particularly important for them to really be like, oh, someone gets it. Oh, I'm not actually going crazy. Oh, you have that symptom too? You mean you get dizzy from going into grocery stores? You mean when you look at carpets that makes your head spin? Like they really need to feel that connection first before they can proceed. And that's why I've made it my mission to put the word out there, because there is, again, as you said initially, the work is so similar. I mean, it's essentially the same stuff as you do for chronic pain or for some of these other chronic symptoms, but the books all say pain. They all say pain.
Yeah, and you know what? So I when I started the mind body journey, and I just love what you're saying. Also, I don't want to speed past that. The being seen part, that is being seen in hell, that's the first port of call, really. I really feel that. Um and now I forget what I was gonna say. What was I
Oh,
gonna
sorry.
say?
That's okay.
The
Yeah, it's a good.
something about the invisible symptoms. Oh yeah, got it now. So when I first heard on the Curable app, like I think it was Dr. Schubiner or someone anyway talking about the phantom leg pain and how all pain was created in the brain. And I already had a background in biology and anatomy and physiology, and so I really love that kind of information. So that's the first time I felt really that seen and understood, and that connection. I felt that connection. And that was actually enough for me to decide that I was going to apply it to everything else that I experienced because it was like Dr. John Sarno and Dr. Schubiner and Dr. Strax, but no one was talking about period pain or gynecological things or like
Yes.
womb things, right? But I just applied it to everything I was experiencing, like full throttle. It was just my response in the moment. I think I was just ready and I was done with everything. Um, I don't even know. Oh no, Dr. Schubner did have a talk about a kid that he treated with severe stomach issues, and they did a scan on his brain, this kid's brain, and they were able to see that his brain was lit up like a Christmas tree, he said. So that's the only bit of information I also had about connecting it to IBS, but I think I even blasted through my IBS before having that information. I just really was able to apply it to everything. Um, and I like to encourage people because people do like come to me with, well, what about this and what about this? And if I don't know about it, I never want to say to someone like, oh, well, that's not neuroplastic. I don't know if you can. I'm just like, hey, like, be curious. Where and how could stress be in your nervous system be affecting that diagnosis or that part of your body? Obviously, I'm not a doctor and I'm not a scientist, but I just like to maybe plant seeds of belief and undo the narrative that so many people have out there of like, I'm stuck with this for life. This is incurable. This is this. This is this. It's like maybe just having a more expansive
Yes,
perspective.
which is what you're describing takes a special, either a special kind of person or a person who's suffered enough that you can just kind of let the doubts be and just go anyway. And this is what I see, especially people with dizziness suffering with, because so the vestibular system, that's our sense of essentially our sense of balance and orientation, it naturally, when we are disoriented, when the vestibular system is not working properly, you have an automatic fight or flight response. So it's not just, oh, only people who have generalized anxiety disorder end up with this. No, anyone with any kind of disorientation or vestibular type symptom, not any, but 95% of them will find themselves with anxiety symptoms as a result of the disorientation symptoms. So what that ends up leading to is that these poor folks not only are dealing with these really distressing symptoms, but to make the leap that you're talking about is harder because they're full of anxiety. And anxiety naturally leads to intrusive thoughts and doubts and catastrophizing and ruminating. And in many cases, the people I work with have no experience with those things. People who've had a lifetime of anxiety sometimes even have an advantage over them because they kind of know their own minds aren't reliable. But people who've been chugging along, living a relatively normal life, who think of their minds as quite reliable, and then suddenly their minds are giving them all these catastrophic thoughts. And then I'm telling them, hey, read this book, suspend your disbelief, and just go with it. It's hard. It's really hard. So it's so impressive to me when people like you are able to do it. I see this is one of the biggest challenges that people face when they're trying to at least get started getting better. Just that feeling like, how do I work with all these doubts that I have?
Well, and I can say for that I still had doubts. Like I still had doubts and I tell you what actually happened. When I discovered the mind body connection, I had all these aha moments. I went all in and I just consumed the books that like nonstop, 24/7 for a few weeks. I don't know how long. And I did walk into a shop and buy these foods that I hadn't eaten in so long and I ate them and da da da. But and I had lived a life of anxiety and depression already. But what happened then was, yes, my IBS was gone. Hallelujah. But I then experienced anxiety on a level, and this is someone who I had been on multiple medications for anxiety. I had been panic attacks, suicidal, right? But this was like the I that the anxiety I experienced when that's the symptom imperative when my IBS shifted it was just like from another world.
Yeah.
And I couldn't sleep at all. So I had and I was studying law. I had gone back to just doing some exams, and I hadn't slept for days. And I walked into the exam, and I just like I just wrote down all this information. Usually people don't have enough time to finish the exam, and I left after like 20 minutes, and I was like a zombie, and I walked home. But yeah, I was just rattling and shaking and but for me and of course my intrusive thoughts and my mind was going crazy. But the difference was I just had this sense of ease, even though I was experiencing more panic and anxiety I'd ever experienced in my life. I had this sense. It was like I wasn't fully 100% sure that this was going to end. I wasn't fully 100% sure I was going to even make it to the end of the day. I was suffering, but there was this little nugget in me that had happened that I had blasted through my broken free through my IBS, and I had this new information, and it was like I just had a new like a glint in my eye, or I had a nugget of hope. And then I would just say that that little nugget has just continued to grow. And
Mhm.
my bladder syndrome I had severe bladder syndrome as well, and that got worse. So the anxiety and the bladder syndrome, but I just kept chipping away. And people always say, about the doubt and everything, like I still have doubt about everything in my life, every day it's all coming up, like, but I just have this little nugget. I'm gonna say I just have this little nugget that's been growing. And I now also have a lot of evidence that I've built up, that I have broken free from certain things and I have recovered from certain things. And so, yeah, people, they want to eliminate the doubt and they think that, but I just feel like you don't need to eliminate the doubt. I always just say, like, rather than trying to eliminate the doubt, just become obsessed with your dream. Like, is it you want to get on a plane and go visit your brother in Thailand, or you want to eat a fish and chips, or you want to like just get obsessed with your little dream and forget about trying to like eliminate the doubt, because when life gets hard and and things just stir up, then our minds just do their thing that they do.
Yeah, yes. And it sounds like what you're saying is the trick is in recognizing the doubt isn't all of you, right? And that's kind of what I mean when I say sometimes these folks who've never had anxiety, who are used to thinking of their minds as very reliable, they don't realize that their thoughts aren't them. Like they're not, they're just happening inside them. They're part of them happening, doing something. But when you were describing the nugget of hope, I was thinking that I'm translating that to I'm recognizing there's more to me than just this doubt, and that gives me something to work with. It means I can invite the doubt along. It means I can have a conversation with the doubt. I can focus on this other thing that's more important to me for right now. I'm not gonna necessarily resist it or try to argue with it. And that's to me the way. I mean, that's the only way I found that people can work with this.
I love that. Yeah, I really, really love that. Exactly. So it's been so nice chatting with you and connecting with you and getting to know how you're helping clients. Is there anything particularly important that you would like to share about about your work or this journey?
Yeah, yeah. So, okay. So for some reason, I don't quite understand why, um, vestibular disorders are very medicalized. And although, like I said, with tinnitus, and this is again not to imply that tinnitus is easy or whatever, tinnitus, at least there's kind of a foot in the door because there's this long history of treating tinnitus using talk methods, even though, again, I think they're imperfect and not adequate, but they are at least there's some openness in the medical community in the mainstream to doing things that way. Whereas with vestibular stuff, it's so medicalized. So the big message I have for people is that the vestibular world has not caught up with modern neuroscience. The vestibular world in general, and by the way, I'm speaking very generally. I want to give a shout out. There are many neurotologists who are 100% who are in the vestibular world who totally get that this is a biopsychosocial phenomenon and we need to treat vestibular disorders in a very holistic way. So this is certainly not to malign any of my colleagues and the esteemed doctors who work in the field, but in general, in the mainstream still, it's very much a disease model type of treatment. Like there's something physically wrong. We're going to look for something physically wrong. We're going to treat the thing that's physically wrong, and then we're going to get rid of your symptoms. And honestly, if that worked, then I would be fine with it. I wouldn't be doing what I'm doing. If they had a treatment that actually worked on this, I would be fine. And we would just do that, and I would go do something totally different. But the fact is, many vestibular disorders are not medical problems. They are not medical problems. They do not need medical treatment. Those treatments will fail. And then people are given no options other than going on antidepressants, which I'm not for or against. That's outside of my area of expertise. But to offer people only that is is a huge disservice because most of the people out there with chronic dizziness do not have a medical problem. I would argue the vast majority of them. many vestibular issues do start with a medical problem. So they might have a concussion, or they might have some kind of ear infection that develops into a problem with the nerve or inflammation. Maybe they have a tumor, maybe there's something else going on. So many of them do. Some people just have like a random event and we don't ever know what it is, but often there is some kind of medical explanation for why symptoms started. But what makes them chronic is I almost said almost never. It's in many, many cases. I think probably about 80% of cases from my experience, we're dealing with a potential biological issue that started the whole thing, but that's not what's keeping it going. It's more of a psychosocial thing that's keeping it going. And to clarify for people who aren't familiar with mind body work, when I say psychosocial, I do not mean psychological. What I'm referring to is the fact that we're dealing with a nervous system sensitivity issue. We're dealing with a problem in how the brain processes information, not a like an organic, like damaged nerve problem that's causing the chronic symptoms. So my message, although that was very long-winded, you asked a very simple question and I gave you a very long-winded answer. What I want people to know is that chances are, if they have chronic dizziness symptoms, they have a central sensitization issue or a nervous system sensitivity issue, not a medical one. Of course, they need to make sure there's no medical problem first. That's the first thing we do. But chances are that's not what's keeping the symptoms chronic, which means they're in the right place. It means that they need to listen to you, and they need to listen to Dr. Schubiner and Dr. Schechter and Dr. Clark and Georgie Oldfield and all the other wonderful leaders in our field. They need to listen to them because it's the same stuff. It's just ignore the words chronic pain, insert the words chronic dizziness, and you're doing the right things.
Yeah, like I never had back pain, but I used to listen to the back pain stories. I was like, oh, this just applies. So if someone has this chronic dizziness issue or tinnitus, and they go to the medical system, what are they usually facing? What kind of like narratives are they getting, and what kinds of treatments are they getting?
Yeah. Yep. So with tinnitus, here's how a little different. Is it okay if I speak to both? Because I think
Please
people
do,
with
yeah.
either kind of symptom need to hear this. So with tinnitus, what they'll usually be told is, um, again, assuming there's no medical problem, occasionally tinnitus can be caused by a treatable medical problem. So again, I'm always assuming we're past that stage, there's nothing medical. What they'll say is, this really upsets me. They'll say something like, you have damage to your hearing nerve or to your inner ear, okay, which by the way is generally true if you have hearing loss. There's probably, assuming you have something called sensory neural hearing loss, which essentially means hearing loss associated with the decline of function of the inner ear or the nerve. They'll say you have permanent damage to one of those structures, and that's the cause of your tinnitus. It will never go away, but you can learn to manage it. That's the message that they'll be given. And again, this is what we talked about at the very beginning of conversation. This is setting the bar so low. It's just so low because what they're saying. So earlier I was saying the vestibular world often is in this like biomedical model. Same thing for this tinnitus explanation. It's a purely biomedical, like cause and effect kind of explanation. You have damage to the nerve. Your brain has it, the tinnitus is being caused by the damage. Your brain has no choice but to hear tinnitus. Now we just have to manage your reaction to it. That's not how hearing works. That's just not how hearing works. And this was true back when I graduated from graduate school, which was over a decade ago now. So we've known about this for a long time. We do not hear with our ears, we hear with our brains. If you're hearing something, it is your brain hearing something. It's not your ear hearing something. Your ear and your nerve are just detectors. They're just detecting sound, and your brain has to decide what to do with it and what to make of it. So it's very true that when you have hearing loss or damage to your hearing nerve, that you might have a little bit less information going to the brain than normal. Like your brain's getting maybe a little bit less or a little bit of a different signal from what it used to get. But does that mean your brain has to interpret that difference as sound? No, it's a brain interpretation. It's a decision the brain makes. This means sound. And what happens with chronic tinnitus is your brain decides, A, that that new information means sound, which isn't a given. You and I'm in my late 30s. My hearing nerve is for sure not working the way that it did when I was 20. I probably already have altered information going to my brain, but I don't hear tinnitus because my brain just hasn't decided that that means a sound. So that's not a given. That's one thing. Your brain has to interpret that as sound. And the second thing is your brain has to decide that sound is important and potentially dangerous. That's what creates chronic tinnitus. There are two decision points that your brain has some has some choice about essentially. So what we're doing in mind body work is saying, how can we influence those choices by helping your brain potentially decide that things aren't dangerous or what we call salient, which basically means something it needs to pay attention to. So the message people are being told is just flat out wrong. As far as I'm concerned, I'm sorry, you guys can come after me with pitchforks if you disagree. But the message people are getting is flat out wrong, and it's harmful because again, it sets that bar so low. And I'm very grateful to people who help people manage their tinnitus. That's way better than not managing your tinnitus and feeling terrible all the time. And bless them for doing that. But that's just not that kind of message, I think, probably prevents people from recovering when they actually could just recover and just not hear tinnitus or have it be so irrelevant to their brain that they only hear it when they listen for it.
I am just fascinated by everything you're sharing. And when you described what people are told when they come looking for help with this symptom, I felt the weight. I felt the weight, the burden of
Yeah.
that diagnosis and
Yeah.
the description of like the damage and the
Yes.
foreverness of it. And that narrative then is going to just hold you back from healing for sure, but just be such a weight to carry. Talk about anxiety, like just giving you so much
Totally.
anxiety, like how am I gonna live my life, do my job, whatever I need to do with that as a life sentence. So
Absolutely.
so what kind of because the one one of the parts of this for any of these symptoms is really shifting the narrative around the symptom and the cause of the symptom. So what kind of and I what you've been sharing already has been so interesting. And are there any other tips that you have for people to just ease up like and really start
Yeah.
to shift that narrative? Yeah.
Yeah. With tinnitus, what I like to say is when they say that there's no cure for tinnitus, what they mean is there's no cure for brain noise, meaning the bad information or the reduced information your brain's getting from your hearing nerve. I don't care about brain noise. I care if you hear a sound. So there's a difference between you hearing a bothersome tinnitus sound and your brain having background activity that can't be changed. I don't, Aoife, you're a lovely person. I don't care about your background brain activity. I just don't, right? What I care is if you have a symptom. So that's my message to people with tinnitus. I think that's the most important key thing to understand. There is your brain is choosing to hear the sound. You're not choosing it. It's not your fault, but your brain, for reasons usually related to predictions of threat. So your brain is usually exquisitely sensitive to the sound for multiple reasons, maybe stress in your life, maybe anxiety, maybe something associated with the sound. And these are things I know that you probably talk about a lot here. But for whatever reason, your brain is really interested in this sound and it's looking for the sound. And that is not something that it has to do. It's not something that it has to do. And through using the methods that we talk about in the mind body community, that can change. And in fact, one of the things, so of course, I focus a lot on dizziness. I have 43 success stories on my channel and counting. It is my mission to have a library of hundreds of them. So people can just put on a playlist when they're feeling scared and just like listen to hundreds of hours of success stories. I'm going to have my first tinnitus and hyperacusis one coming soon because yes, because I haven't I don't see as many people with those problems, so I just haven't had people volunteer to do a success story. But it does not always have to be this way. It doesn't. And the first step, I think, for tinnitus, at least in my opinion, is this education piece. The second step is starting to relate a little bit differently to the sound you're hearing. And that starts with understanding that it's actually just an error, that your brain is noticing this brain noise that's just irrelevant, non-dangerous brain noise that your brain's paying attention to. But then you have to put that into action and show your brain that. So it's not enough to know it, you have to show your brain that. And that's where we get into things like somatic tracking, which I think is incredibly effective for tinnitus.
Definitely. I love what you said about showing the knowing and then the showing,
Yeah.
and actually finding ways to send yourself those safety signals, because it's hard when you get that fight or flight response, that panic, that worry, that learned response. You're just going to find ways to interrupt that, and then it's through repetition.
Mm-hmm.
Um,
Doing and doing.
doing
Yeah. It's
exactly,
doing.
and yeah,
Yeah.
doing and the repetition of it.
And that also helps with what we were talking about earlier, which was the doubts. There is no better way to demonstrate to your brain that something is safe than actually doing something, right? Then like this is something I bring up this story a lot, but it just fits so perfectly in so many contexts. But when my younger daughter is afraid of a monster in the closet, I'm not just gonna like stand there and talk to her about it. I'll there and there. I use this metaphor for a few other things. Maybe we'll get into that. But I'm gonna I'm gonna hold her hand. I'm gonna like put my arm around her. I'm gonna go to the closet with her. We're gonna look together. Like we're gonna do something to show her, first of all, I get it, and I'm attuning to her feelings, but I'm also demonstrating safety with my actions. We're doing something. It's if I were just trying to talk to her about it and not demonstrating those things, I think it would be a lot less effective.
I love that. And taking it's like you take yourself by the hand. You take yourself by
Yes.
the hand and you show
Yeah.
yourself the
Bingo.
closet.
Yeah.
And that's hard. And I mean, it can be the first few times will always be hardest, but your brain learns. It really
Absolutely.
does.
So the message, is it okay if I go to the vestibular side now, what they're
Mm,
told? They're told something a little different. So I think, again, they're both just uniquely damaging in their own ways. I'm not going to compare them, but people with vestibular disorders are usually told one of two things. They're often told, this is just in your head, this is just anxiety, and you need to just like live your life and ignore it and maybe see a therapist so you stop being so anxious, which is like just so incredibly not helpful to tell someone. That's one thing they're often told. The second thing that they're told, and so the first is usually by people who aren't as uh, tuned in to what vestibular order disorders are like. These are usually more general practitioners who may say this to people. Again, not maligning any group of anyone. I'm just saying this is often the experience people have. And the second message they're given if they go through a bunch of tests is, oh, you have PPPD, which is a description of symptoms. Aoife. It's like fibromyalgia. It's you have this thing, but we don't know why, and it describes the thing you have. It's circular. It's a circular diagnosis. You're diagnosed with the symptoms that you have, which gave us a diagnosis of the symptoms that you have. It's kind of meaningless. Or they're given a vestibular migraine diagnosis, or they're given mal de Barkmont, which is MDDS, or cervicogenic dizziness or post-concussion syndrome. All of these things basically are just descriptions of symptoms. And there are others, but those are the main ones. And you have this thing that has no cure, and it's a chronic condition that can be managed with rehab and medication. That's what they're told. Yeah. And in the best case scenario, sometimes the awesome, like there are some good doctors out there, really, and who are up to date on the latest. And they'll sometimes recommend cognitive behavioral therapy, which is, again, we've talked about this already today. CBT is a life-saving tool. I do a ton of stuff from CBT, especially the stuff that leans a little more on the acceptance and commitment therapy end of things. I'm all about it. but it's not necessarily sufficient. There's an education piece and then an emotional piece that sometimes CBT doesn't touch, especially when it's kind of under the umbrella of management. That's my big criticism of a lot of CBT approaches. And by the way, head to head, Dr. Brandon Yarns just released a study comparing CBT and EAET, emotional awareness and expression therapy, and EAET blew CBT out of the water for chronic pain. So again, I'm not saying one study means this, but there's some pretty good evidence in the literature that we should be doing a little bit more. Sorry, but I'm on a tangent. My point is that even though that's an option, most people aren't even getting that. They're just being told this is chronic, and they can go on some very reputable medical websites that I'm not going to name and get that exact message. It's incurable, it's chronic, it's forever. You're going to go through periods of remission maybe, but you're going to manage it and have it the rest of your life, which is also just, how do I put this? The arrogance in giving people this message. These diagnoses are new. And yes, we have a few decades of research describing chronic dizziness symptoms, but it was relatively low quality, very small groups, not well controlled, right? So we don't have a huge body of research upon which to base a sentence like this. And I think people who write this kind of stuff just think they're doing no harm. And it's the absolute opposite. Again, why would we set the bar for what's possible down here when it could be up here, when we really just don't have research to back up that this is the only thing you can do? So they make these pronouncements as though it doesn't cause horrible harm with zero evidence that that's actually true. If PPPD was only named, I think it was in 2017, so it's not even 10 years old, this particular diagnosis. Yeah, and yes, we have some previous research on previously named conditions, but again, the research is not great. How could we point to that? How can reputable medical websites point to that and say, this means you're going to have it for the rest of your life? That is, I don't know about you, but people in my life live longer than 7 years. So like, how are we looking at 7 years of research and drawing a conclusion like that? Especially when, and this is another reason I'm so passionate about having this success stories. I want the evidence to be so overwhelmingly indisputable that people can get better from it, that people just can't believe that stuff anymore, because it's just not true. From my experience, it's not true. And I know I'm on a soapbox. I love soapboxes. Thank you for letting me get on one. But also very damaging, not helpful messages, and wrong from my perspective.
Wow, I'm just so honored I got you on a soapbox because this is
It's not hard, but
such
yes.
such valuable and such important information. And yeah, when you think of the burden and that low bar and the
Totally.
damage that does compared to yeah, just offering someone like something completely different, the potential, not only the tools and the pathway to heal, and other people who have done it too, but just like my what my doctor did, she didn't have the answers, but she just didn't limit me. She just
That's
didn't
right.
she
That's
didn't
right.
have the answers. She really didn't. She even though she actually kind of, she suspected them, but she didn't even put them on me. But she just decided to not do the other thing, and that was really powerful for me and really supportive for me. But now here you are, and here are so many people. Like I often say, in 2017, I hadn't met one person who had in all my years of search and consultants all around the world and ordinary other people who had been trying all these different diets and potions and everything, I had not met one person who could say, I had this condition. I recovered from it. This is what I did. And now there's just like pop, 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 pop. It's just so many people and it's so exciting. And for me, I get so passionate about it too. I just feel like, what's next? Who's going to come out with their video on what we thought couldn't be healed or couldn't recover from, and someone's doing it. So
Yeah.
it's exciting times. It's exciting. I feel super blessed to be here, to be able to share my story, to be able to hear the work that you're doing, and to hear that you have so many success stories. It's something to be really grateful for.
And and this is near and dear to my heart, the things we're asking people to do are like not invasive, not tens of thousands of dollars, not potions, not pills, not any of that, not risky. We're asking people to just kind of generally be nicer to themselves, maybe do some journaling, maybe join a coaching group, maybe get some support, but we're not selling stuff to people. And the work that we're doing, the way I see it is, what's the risk you're taking by doing mind body work? Okay, so maybe it helps you manage. Okay, and for those of you maybe just listening, I just did quotation marks. I don't believe in that word, as we talked about for this particular context anyway. Maybe it just helps you manage better. Well, cool. That's better than you were doing before. If you're nicer to yourself and you still have symptoms, I mean, it's going to be a better life. But that's just kind of the least of what you could possibly get out of it. Imagine if you're one of those people who actually breaks free, as you said, totally breaks free, and you live a completely different life. I mean, so why not try this? Why not? That's, and again, part of what makes me passionate about doing what I'm doing, given the fact that people are given these kinds of messages, often the bar is set so low that all I have to say is, well, what do you have to lose, really? They're telling you there's nothing that can be done. So here, try journaling, see what happens. I mean, what do you have to lose? Because the bar they're setting isn't very high.
I love that. It's so true. It's so, so true.
So
And
true.
this, when you read the side effects and the risks that so many of these medical treatments can and do have, it's like the side effects of this, like, oh, okay, maybe my symptoms haven't changed, but I'm so much nicer to myself, and like I'm smiling more. I'm painting again, or I'm dancing again, or something like that. Then it's like,
Yeah,
why would you not try it? Yeah.
absolutely. Absolutely. And I am very open-minded about like what medical science can offer people. I'm never going to tell people, don't keep your eyes open to see what advances come. But at least, especially as the way things stand right now, there's really, for my people, for tinnitus and for vestibular stuff, there's really not a lot that medical science has to offer that helps people. So it's really kind of a no-brainer, right?
I like that you shared that. I think, I meet so many people who are bouncing around doctor to doctor to doctor to doctor, and I think it might help someone just release that habit and maybe pivot a little bit,
Mhm.
which could really help.
Yeah. Yeah.
Yay. Thank you so much. It was fascinating. I love all the science, the sciencey, doctory stuff that you're able to contribute. It's so valuable and it's so interesting to me. And I know it's going to be really helpful for anyone listening. So, yeah, and it was just super nice to meet you personally and
Likewise.
get to know you.
Likewise.
So,
Yeah, thank you
yeah.
for giving me the opportunity to get on those soapboxes. As soon as you asked that question, I'm like, oh, here it comes. Here it comes. What are these people normally told? I'll tell you what they're normally told. And
Well, it's so powerful that they have you as their voice. So you stay on that soapbox. You don't
I
get down
will.
off
I
that
will.
soapbox.
I will. Honestly, I will happily give up my soapbox when there are better options. And I tell people all the time, if I find a better way, I will happily put out a video about it. I will put it on my YouTube channel. Just stay tuned to my YouTube channel, because if I find the final frontier solution, here it is, I will put it on my YouTube channel. But until then, I'm just sharing what I know to work the best. And I mean, this is it. This is what works the best.
So stay tuned. I'm gonna leave Dr. Yonit's information in the description below, and you'll be able to see her YouTube channel, success stories, and any of her offerings and her beautiful wisdom. I'm gonna start to say like and subscribe because I never said that before, but do like and subscribe and get involved in
And leave
the
comments.
conversations and leave comments and questions because this is what we're all about. We just want to chat and talk more about this and help other people to break free and recover. And yeah, thank you so much again and have a beautiful day. And I'm
Thank
sure we
you.
will be in touch.
Thank you. And thank you for the beautiful work you're doing as well. Thank you.